Jason, thank you for joining me today.
Thanks for having me.
Tell me a little bit about yourself and what you do for the GABA community.
So I own a company called Across Healthcare. We have a software platform called Matrix. In 2019, I felt I had a calling to build this platform for the rare disease community. I actually have a rare disease, so mine doesn't affect me that much, but it took me 32 years to find my diagnosis, so I can relate in the diagnostic journey that many people go through to try to find their disorder. So once I found it, I knew how to treat it, and it just all clicked. So from that aspect, but I've had the privilege and honor to work for some really prestigious. I've worked in the healthcare technology space for 26 years, but I've worked with like Cystic Fibrosis Foundation, Muscular Dystrophy Association, and some really large provider organizations like American Heart Association, collecting their data. So I knew how to do that at scale, and I knew some of the benefits of that. So in 2019, again, I felt I got called to build a platform to collect this data in these organizations like Cure GABA A. They know a lot, but there's so much below the surface in clinical research. How do you get ready? How are you ready for regulatory research to guide yourself toward that? And how do you prepare and de-risk yourself for a lot of that? So I brought a lot of that from my professional background. I brought my personal passion behind that and said, I'm going to do this. So that was in 2019. Now Cure GABA A is one of about 126 advocacy groups that I support. We knew going into this in the rare space, it's global. So these populations are pretty small. So you have to be thinking global. So we're collecting data to date in 143 countries around the world. Our platform's in 11 languages. And we haven't advertised a bit. It's all word of mouth. So we started collecting this data. That group told this group that told this group. And really, I run my group very philanthropically, and it's with a personal passion. And my team behind me, a lot of them have ties to the rare community as well.
That's amazing. That is amazing. The exact thing that you do for Cure GABA A is collect this data. How does that data get put into use?
So there's a lot of ways we get it in. So patient reported data is a big part. So the first year we spent, advocacy groups, caregivers, patients themselves, because we do a lot of adult onset, not just Cure GABA A's. A lot of our groups are pediatric onset, right? So we work with those. So it's mostly the caregivers, but we spent a lot of time the first year saying, if I could build you a system to collect data, how could it be useful for you? Which is not what a research system usually asks. It's like, all right, how do I suck in the data, use it, and never shall the advocacy group see that data again? Maybe they get some reports and high-level analytics out of it, but I wanted to build a system where they wanted to be in that platform for themselves every day and glean insights of how they're doing against benchmarks that they set, collect their own data points. So if they saw their child was having night sweats and no researcher or the group is not asking that question, they can input it into my system, start tracking that. And by the way, you start seeing 5 moms that are tracking that same thing. And maybe this is a trend in the community. So it was take a lot of the industrial research platforms that I've used in my past positions and use that as a background, and then pivot and say, how can I have this be very useful to the patients and caregivers? And then once we have that, synergy, they want to be in there, they want to be inputting their data, and then you can turn that into insights. And I talked earlier about like de-risking what's going on. So a lot of our groups don't have therapies specifically, and Cure GABA A kind of falls into that, right? They got some they're working on and show positivity, but like most of my groups don't have proven therapies that are through the pipeline in their area. So you want to bring, if you can say, hey, biotech, pharma, researcher that wants to build this ASO for my disease, if I've got data on my population, that's huge. And that if you look at where FDA is going with their regulatory guidance, it's bring these, what they call natural history studies, these longitudinal, long, 10, 15 years if you can get it, 20 years if you can get it, long, analysis of what's been going on with the community if somebody doesn't have therapy. So then once you start introducing these therapies, you can have that comparison and these, what they call endpoints to compare to.
So if I'm newly diagnosed, how do I start to use your platform to learn? Am I just tracking my data points? Do I get direct access to look at insights?
So each group's different. So Cure GABA A is part of a umbrella organization called Combined Brain. Combined Brain is very organized, and most of our groups use a core set of data. There was an NIH-funded set of surveys that a lot of these groups use as a baseline. Combined Brain does as well. So there's a set of surveys that ask like high-level health and wellness, like you have problems with your eyes, you have problems with your ears, you have problems with your so it goes down the line of what do you have issues with, and then it starts drilling in, and it'll issue you another survey. Okay, you said you had problems with your eyes. Let's ask you more detail. You said you had problems with neurological issues. That goes into, there's like 3 levels deep on seizures, like which Cure GABA A has. So we can glean a lot of information through those standard instruments, and those are recognized by FDA as standard instruments. So we know if we use that, but each group eventually figures out there's nuances to their disorder. And the good thing about Combined Brain, it's a bunch of neurodevelopmental, so there's a lot of commonality. So they build these common sets of what are we going to ask the population, so they can actually compare across the different diseases, but then each one can also branch off and start collecting their own data. So that's just survey reported data. We also integrate with EHRs. So in the US only right now, we can pull EHR data. So a caregiver for a patient would log into our system, start looking through the directory of hospitals. So here in Atlanta, Emory University would pop up, and oh yeah, that's my site. So then you would log into through our system, log into your MyChart, Epic MyChart, which is the patient portal for Epic, which is the system Emory uses, and then you give us access. So every 7 days, we're pulling data. So if you go to the hospital for anything, we get that data. We can see labs, immunizations, vital signs that are taken. All that data comes to us, so we store that. So that's another method where nobody's keying that data in manually. We also have over 500 devices that we connect to. So if a group, so a big example for this is we have a group that has diabetes or is very interested in sugar levels. So we do continuous glucose monitors. So we're tied into like Dexcom, continuous glucose monitors with Dexcom, or some of the others as well. So we ingest that data as well. So we have all this rich data set that's coming from all this, not human curated or inputted, as well as that as well. And you really need that balance, right? Because there are a lot of quality of life things and what's going on daily that you need to capture, but you also need that raw clinical data that's coming in to kind of baseline that.
So if I am somebody who just got diagnosed with a GABA A variant, right? And what would you tell me about your platform so I can learn? Because a lot of people that will be listening to this are just diagnosed or have just found our platform and learning about, or just found GABA A, Cure GABA A, and are learning about what you guys offer. What would you tell them? How to use it? What's the best practices?
So to back up, one of my theses is I actually don't want to be seen. I just want to be the best tech in the middle that enables this. So usually it's not me telling that person anything. It's the Cure GABA A has those liaisons that can talk to the patient, because my thesis coming into this is I wanted to partner with these patient advocacy groups because they are the blood, sweat, and tears of the community. The patients trust them. All these new patients can relate, and they can, even though, yes, I have my own story in rare disease, I don't have the Cure GABA A story where these moms that are on the phone with these other moms can totally relate, and they can tell their stories. So that's more how it plays out. It goes back to, under the hood, we're the platform they use, but the story would be told from the Cure GABA A side of, here's why you want to use this. We want to collect this data to have a rich database to baseline so that when talk about the de-risking of data, and we want to be ready for any therapy and don't want to wait, because a lot of people will wait and then it takes 15 years to collect that data to then have a therapy launched in their disorder. So it's all about having that data set ready to go as soon as possible, and each person contributing not only their data. Cure GABA A, we don't store specimens, but there's biorepositories that Cure GABA A participates in. They consent to all that through our platform. So there's all these ways in which you can, as a newly diagnosed patient, that you can contribute, through surveys and data that you pull from your charts and all that, but also specimens that you can provide as well to have that, again, ready to go data set for anybody that's wanting to do research or provide therapies in the Cure GABA A space.
Well, Jason, what you are providing is not only needed, but it's incredible, the work that you guys are doing. So on behalf of Cure GABA A, thank you for all the work that you've done building this platform, and I appreciate your time today.
Thank you very much.
Thank you.